One of the worst medications you can have are high blood pressure drugs. Now, let me explain in a brief paragraph for you. See, high blood pressure, or known as hypertension, is a common health condition that actually affects millions of people worldwide. It occurs when the force of blood pushing against the walls of your arteries is consistently too high. If left untreated, high blood pressure can actually lead to serious health problems such as heart disease, stroke, and even kidney failures. And many people with high blood pressure rely on medications to keep their blood pressure under control. While these medications can actually benefit, they can also cause some side effects that could be harmful for your health. It's important to be aware of these potential side effects and to work closely with your healthcare provider to find the best treatment plan for you. And the simple solution to keep in mind: high systolic, meaning high levels of calcium, high diastolic, and very low levels of magnesium. It's that simple, but this is one factor of the equation. Guys, if you don't mind, subscribe and give me a like and comment below if you use blood pressure medications and what kind. And I hope this video can help you wean off or at least guide you to better health. Now let's get back to the video. It's only gonna be roughly under 7 minutes long and it is gonna be worth watching. So that said, here is a list of dangerous blood pressure drugs, and keep in mind most of it, not all, will actually conflict with your homocysteine levels, which is another factor to why some of you already have high blood pressure in the first place. So one class of blood pressure medication is called central agonists. Now these drugs include like clonidine and guanfacine, and central agonists work by actually slowing down the heart rate and relaxing the blood vessels, which helps to lower blood pressure. However, they are not usually the first choice for treating high blood pressure because they can actually cause some side effects like depression, fatigue, constipation, and of course dizziness. And in rare cases, central agonists can actually cause liver damage or a decrease in red blood cells. Alpha blockers such as daxazosine or taururzin are another type of blood pressure medication. They work by actually blocking the effect of adrenaline, a hormone that actually causes blood vessels to constrict. So while alpha blockers can actually be effective at lowering blood pressure, they can also cause a sudden drop in the blood pressure when standing up, which may lead to falls and visits to the emergency rooms. See, in fact, a study published in the Journal of the American Geriatric Society found that older adults taking alpha blockers had a 1.8 times higher risk of falling compared to those not taking these medications. Vasodilators like minoxidil are another class of blood pressure medications. They work by directly relaxing the muscles and the walls of blood vessels, allowing them to widen and lower blood pressure. However, vasodilators should only be used when other treatments haven't worked or in emergency situations. The problem is they can cause major side effects like rapid heartbeats, headaches, dizziness, and swelling in the legs and feet. Then we have loop diuretics such as furosemides are actually often prescribed when fluid retention is actually a problem. See, they work by helping the kidneys remove excess fluid from the body, which can actually help lower blood pressure. However, loop diuretics can actually cause dehydration and imbalances in important electrolytes like sodium, potassium, and specifically magnesium. And these imbalances can actually lead to side effects like muscle cramps, fatigue, confusion, and nausea. One of the most popular ones, beta blockers, including metoprolol, are another common type of blood pressure medication. They actually work by blocking the effects of adrenaline on the heart, which actually slows down the heart rate and reduces the force of heart contractions. So while beta blockers are generally well tolerated, they can actually cause side effects such as fatigue, cold hands and feet, vivid dreams, and erectile dysfunction in men. Calcium channel blockers are often used as the first line treatment for high blood pressure. They actually work by preventing calcium from entering the walls of blood vessels, which helps them relax and widen. Now, the side effects of calcium channel blockers are less common, but can actually include swelling in the feet and the legs. You have dizziness, headaches, you have shrinkage of your brain, and of course, heart palpitations. ACE inhibitors are particularly effective for people with diabetes, chronic kidney disease, and of course heart failure. They work by blocking an enzyme that actually narrows blood vessels, which help to lower blood pressure. Now, ACE inhibitors can actually cause a dry cough in some people and may rarely lead to a serious conditions called angioedema, which actually causes swelling in the deeper layers of the skin. See, while medications can actually be an important tool in managing high blood pressure, making lifestyle changes is often the best way to actually prevent or reduce hypertension. You have regular physical activity, stress management, quality sleep, limiting alcohol and tobacco use, maintaining a healthy weight, staying hydrated, and eating heart healthy diet can actually make a major significant in the blood pressure levels. I can sit here and give you more than 10 different tips to a healthier lifestyle, but for a fact, you can Google that information. So instead, let's dive into the supplementation to actually fix your high blood pressure from top to bottom. So starting, we have nitrate supplement, magnesium ionic chloride, L-taurine, and benfotiamine. These are your top supplementation. And if you have no issues with oxalates or are sensitive, then add arugula and celery to your diet and a handful of berries every night, as it actually has some added benefits. Now, average person only consumes roughly about 10 milligrams of nitrate per day, and to activate and convert to nitric oxide, we actually need at least 500 milligrams of nitrate. So if you are eating arugula, you would actually require to consume 250 grams per day. And if you are thinking of beetroot, you do require at least 300 grams per day. So in conclusion, while blood pressure medications can be an important tool in managing hypertension, not really at all, due to the freaking side effects, could be actually quite harmful for your health. I think making lifestyle changes can actually help prevent or reduce high blood pressure. And if you are taking a blood pressure medication and experiencing side effects, it's important to have a chat with me. Therefore, I can guide you to a better health. And do keep this in mind, guys. Hypertension is 100% reversible.